Hi, and welcome back to another skills check video. My name is Kalani. I'm a student physical therapist at Midwestern, and today we're going to do some cardiopulmonary skills. On the docket, we have heart auscultations, lung auscultations. We're just going to do some tactile fremitus. We're going to take some vital signs, some vital measures like blood pressure, heart rate, O2 saturation, and we're also going to do a dynamic chest evaluation. So first, we're going to start off with the heart auscultations. So I have my patient Jonah here. So Jonah, today we are going to just take a look at the heart, just make sure everything's ticking correctly, okay? So in order to do it best, I need to have skin-to-skin contact, or skin-to-stethoscope contact. So if it's okay with you, could you remove your shirt for me?
Sure, doctor. I'll take off my shirt for you.
Thank you. Thank you so much. And just because there's a little bit of chest hair, I am gonna just wet it down a little bit. The places that it matters. Just because we want to get the best sound, okay? Make sense?
Yep.
Okay. Gorgeous.
Thanks.
All right, so first we're gonna go through and we're gonna listen with the diaphragm, and then we're gonna do the bell. The diaphragm will tell me if you're the normal sounds. The bell will tell me if there's any indications of abnormal sounds, okay?
Got it.
All right, so just make sure to stay quiet, just breathe regularly. Second intercostal space, so this is the aortic. Right, pulmonic. And just a little lower tricuspid. And mitral. Beautiful. Okay, now we're going to turn the head. We'll use the bell now. Great, everything sounds normal. Okay, now we're going to go ahead and do the lung auscultations. So we'll listen at 12 different points in the front and 12 different points in the back. All right, Jonah, so what I'm gonna need from you is at each point that I go and listen, I just need you to do a deep breath, and that's gonna be in through your mouth and out through your mouth. Does that make sense?
Yep.
Okay, do you wanna practice before?
Nah, I think I got it.
Okay.
I've been breathing my whole life.
Hopefully. Okay, we're also going to listen to it on the diaphragm. All right, go ahead. Great, no abnormal sounds there. How are we feeling?
A little lightheaded.
A little lightheaded? Okay, let's take a minute and then we'll do the back. All right, so now we're back and we're gonna listen to the back side of the lungs. breathing as normal. Same thing as before. Breathe in through your mouth and out through your mouth. Okay?
Okay.
Go for it. Wonderful. No abnormal sounds, no adventitious sounds. Looks good. Now we're going to test for some tactile fremitus, which just means we're looking for the vibration that's going on in the lungs. Okay, Jonah, so what I'm going to do is I'm going to place my hands on your back in 3 different locations, 3 or 4, and each time I move my hands, I need you to say the word 99, okay? Just at a regular volume. Do you have any questions?
Nope.
Okay. All right, so I'll start right here.
99. 99. 99. 99.
And I'll go on my ulnar border as well, just to be doubly sure.
99. 99. 99. 99.
Great. So he has symmetrical vibration on both sides, so nothing really noteworthy here. Okay, now we're going to assess some regular vital signs. So I'm going to take blood pressure, and I'm also going to do his O2 saturation, and I will take his heart rate after and then confirm it with the O2 sats machine. All right, so first we're going to start with the blood pressure. All right, so I got 142/67. That's a little bit high on the systolic side, but the diastolic is fine, so just a little bit elevated, but should be okay. Is that normal for you?
Yeah.
Yes. Okay. Now we'll take some blood oxygen. I'll find your pulse here. Got my handy dandy watch. Perfect. So I got around 80 for the heart rate, and it's 80 on here. And then 95% oxygen saturation. So that's normal. You're all normal. Perfect. Okay, now we're going to do our dynamic chest evaluation, which includes just an observation of his breathing patterns, his inspiration to expiration ratio, and also his dynamic chest movements, his excursion stuff. So, first, Jonah, I'm just gonna have you regularly breathe. Normally I would do this upon walking in, but since we're here, we're here. Right now I'm not noticing any excessive movement up here, which tells me that he's probably more dominantly lower chest diaphragmatic breather, dominantly. Now we're gonna move. Does that make sense to you? Do you have any questions about that?
Nope.
Okay. Now we're gonna move on to some chest excursions. So I'm gonna go in 3 different places. We'll do the upper, the middle, and I'll have you turn around for the lower, okay? So same thing as before with the lung auscultations. When I was using the stethoscope, I'm just gonna have you breathe in through your mouth and out through your mouth, okay? So I'll start right here. A little bit higher. Looks normal here. My hands are going up and down, which is what we want to see. And I'll go right in here. Pick up this leg. This is for the middle. Okay, ready? Good. Even amounts of excursion. That just means my hands are moving out to the side. Great. If I could have you turn around, you can just hang your feet off that way if that works best for you. Okay, I want to be around the 10th rib because the 12th rib is a faker. Okay, ready?
Ready.
Go for it. And even amounts of my hands going out to the side here as well. Really great job. Good job. How you feeling?
So great.
So great. Not lightheaded at all?
No.
All right. So now I'm just going to watch you breathe again, and I'm just going to make sure your ratio looks pretty normal. Really good. So I'm just seeing about 2 to 1 ratio, so it'll take you longer to exhale than inhale. So inhale is about 1. It'll take you about 2 seconds to inhale and about 4 seconds to exhale. Good job.